Welcome, everyone. I'm Dr. Jody Jacobson Fry. I'm the co-chair of the National Workplace Suicide Prevention Committee with Dr. Sally Spencer Thomas. And I'm very excited to welcome everyone to our presentation today on 988, the Suicide and Crisis Lifeline, a resource for workplace suicide prevention with Dr. Michelle Cornette. Dr. Cornette is a data analytics and evaluation lead in the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA. She oversees the Zero Suicide Grant Program and has also served as a program officer for the National Strategy for Suicide Prevention and Community Crisis Response Partnership Grant Programs. She's co-managed the grant for National Suicide Prevention Lifeline, which has since become 988. Dr. Cornette is the past executive director of the American Association for Suicidology. She previously supported the Research and Program Evaluation Division at the Department of Defense Suicide Prevention Office and was military suicide subject matter expert at the Center for Deployment Psychology. She has spent 10 years in the VA system, where she was the VISN 12 Suicide Prevention Director and has received federal and private funding for her program of research, which focuses on suicide risk. She has presented and published extensively on suicide risk assessment, prevention, and treatment, and we're just thrilled to have her here with us today. The national guidelines on workplace suicide prevention are part of a collaborative partnership with the American Foundation for Suicide Prevention and the United Suicide Survivors International. Our national guidelines are founded on 8 guiding principles, and today you will hear many of them throughout the presentation as we try to weave them into all of the work we do. The national guidelines are comprised of 9 practices. They go upstream, midstream, and downstream, as you can see here. And today we'll be honing in on a couple of these practices you'll see on the next slide. While what we'll present today with 988 is a resource for many different practices in the workplace, these are the 4 areas that will be most relevant to today's conversation with Dr. Cornette.
I'm going to provide a pretty high-level overview today of the 988 Suicide and Crisis Lifeline. The goal of the 988 and Behavioral Health Coordinating Office at SAMHSA is really twofold. One has been to strengthen and expand the 988 Suicide and Crisis Lifeline, which historically was called the National Suicide Prevention Lifeline. And then the second goal is to really focus on transforming the crisis continuum of services to include mobile crisis response, crisis stabilization units, crisis respite, and other services, crisis-related services, to include those provided in outpatient settings. SAMHSA's crisis guidelines, which were published in 2020, highlight really 3 pieces to a comprehensive crisis system. Someone to talk to, and we often relate that back to the 988 contact line. Someone to respond, which we think of as relating to mobile crisis, and a safe place, which we think about as corresponding to crisis stabilization and/or crisis respite. There is an existing and growing body of research pointing to the effectiveness of the National Suicide Prevention Lifeline, which is now 988. And at a very high level, essentially, some of the major findings have demonstrated that individuals who contact the Lifeline and speak to a trained counselor are more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful following their 988 contact. We're really moving toward the goal of being a fully transformed crisis care system with the 988 Lifeline at its core. And that is, a big goal, but this is something that we are working toward. And so we think about our 988 work as connecting all people to community-based mobile crisis stabilization, providers, tools and resources, and behavioral health crisis services, both inpatient and outpatient. So for those of you who are not familiar how the Lifeline works, and there have been some changes to this, some additional options added just over the past year. Individuals who call the Lifeline are provided 4 options. Press 1 to connect to the Veterans Crisis Line. Press 2 to connect to the Spanish subnetwork. Press 3 to connect to LGBTQ support for people under age 25, or you can remain on the line and be connected to a local crisis center. If a local crisis center is unable to answer, the caller is routed to a national backup center. And for individuals who chat or text the Lifeline, They are provided an option regarding whether or not they want to speak to a chat text counselor who specializes in LGBTQ issues. And we also now have a Spanish language option within chat and text. This is just a slide to demonstrate the incredible increase in investment in crisis services within SAMHSA, frankly. So historically, the crisis centers that comprise the National Suicide Prevention Lifeline 988, there are about 200 of them. Historically, unless they were providing a specialized function, they received a $2,500 stipend annually. So it was a really very limited amount of money. And there was some money that also went toward the network administrator. You can see just the dramatic increase that occurred between FY 2021 and FY 2022, and then again in FY 2023. And one of the biggest changes that we saw in FY 2022 is that for the very first time, we actually saw funding for crisis across the continuum of services happening from SAMHSA directly to states and local crisis centers, as well as to tribes through grant funding. Just a few updates regarding the metrics. Jody highlighted the 1-year anniversary, and some of these metrics are relative to that. So the launch of 988, the transition to the 3-digit number, occurred in July of 2022. Since that time, the Lifeline has received more than 5 million contacts across all 3 modalities. That's nearly 2 million more than the previous 12 months. And we've also significantly improved how quickly contacts are answered. Calls answered increased by 46%, chat by 141%, and texts increased by 1,135%. The average speed of answer across modalities went from 2 minutes, 39 seconds to 41 seconds. There have been a lot of changes and improvements in addition to the addition of text, which is only a couple of years old. We now have the recently launched Spanish text and chat services, the LGBTQI plus youth and young adult services for those under age 25, video phone for the deaf and hard of hearing, and dedicated culturally competent services for American Indians and Alaskan Natives. And here's just a little bit more detail about that. Spanish chat and text launched on June 10th of this year. And there were 5 centers selected to form a Spanish chat and text network within the overall 200 centers that comprise the Lifeline. The LGBTQI plus started out as a pilot and essentially transitioned from that pilot to a fully fledged sub-network on July 3rd to expand that network with multiple sub-network nationwide providers and expanded the workforce to increase response rate. And then we are very much on the verge, like any day sort of a thing, to launch the video phone services for those who are deaf or hard of hearing. Services will also be available via ASL Now button on 988lifeline.org. And then the Washington's Native and Strong pilot. So currently, this particular service, this is different from the 3 prior that I've mentioned, but this particular subnetwork is only relevant to individuals with Washington area codes who contact the Lifeline. But if you are a person of American Indian or Alaska Native descent, you happen to have a Washington area code, you can specifically be connected to the Native and Strong Lifeline by pressing 4. We've also done a lot of work over the past couple of years in terms of development of resources. I think, many of which are really relevant to the workplace. And I guess I would just add a couple of things. I really think about 988 as a very important resource within the public health approach to suicide prevention for adults. And I also think about the workplace is one of the #1 places to capture working age adults. Another distinction I'll just reference briefly is that I think sometimes people sort of think about 988 as strictly a triage function. The reality is that the majority of contacts to 988 have their crisis resolved in the context of that contact, that call, that check, that text, that chat. And we do encourage individuals to reach out to the Lifeline at any level of emotional distress. Can also include substance abuse crisis. So it really is a clinical service that's being provided and should be thought of that way. Also, and the reason that I highlighted the peer support aspect of workplace suicide prevention as relevant to 988 is that many people don't appreciate a number of our contacts, our Lifeline contacts, are by third parties, so are by concerned family, friends, coworkers, etc., who are needing some guidance in terms of how to help someone that they're concerned about. So please do feel free to utilize the Lifeline for that as well. So would encourage you to visit the SAMHSA 988 webpage, where we have a partner toolkit and a number of other resources. And, you know, it really, any of these that you want to take advantage of as a sort of a partner organization in the effort to direct people, increase awareness of 988 as a resource, you know, feel free. These are there for your usage. There's logos and branding guidance, social media shareables, print materials, end cards, etc., and an additional list of resources. And with that, I'm going to turn it back over to Dr. Fry.
Thank you so much, Dr. Cornette. It's great to see the amazing work in just 1 year, the difference of what's happening with 988, and to learn about all of the resources, especially those that are available in Spanish and really targeting different populations that we in the workplace interact with all the time. So this was a wonderful presentation, and I hope lots of people will go to take a look and use the resources that are available online. For those of you that are watching, we're closing with also a call to action. We hope that you will take time to visit the Workplace Suicide Prevention website at www.workplacesuicideprevention.com. On that site, you'll find a lot of the resources and links, but you'll also be encouraged to take a pledge to make suicide prevention a health and safety priority at your workplace or professional organization. Thank you again, Dr. Cornette, and thank you everybody who's watching today.